We are at a very dangerous place. That's part of an urgent new warning from the White House Coronavirus Task Force. Their report also directs public health officials to essentially take matters into their own hands. Quote, if state and local policies do not reflect the seriousness of the current situation, all public health officials must alert the state population directly. I want to bring in Dr. Nahid Bhadelia. She is an associate professor at Boston University School of Medicine. She's also an MSNBC medical contributor. And Dr. Bhadelia, we're watching CDC Director Robert Redfield. As we speak, he is speaking with the Chamber of Commerce. And Dr. Redfield said something just a few moments ago that I want to play for you and our audience.
The reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation, largely because of the stress that it's going to put on our healthcare system.
Now, to be clear, we've been covering this story now for 9 months. Dr. Redfield is typically not someone who has a propensity for hyperbole. That sounds pretty dire. That sounds pretty stark. How do we begin to prepare for that?
Good morning, Craig. I think that we need to take those personal actions because, the thing that scares me about this moment that I want to drive home is that you see these high numbers. Almost 100,000 Americans are hospitalized. We're seeing 2,500 deaths a day from this disease. We can't become numb to this, but this is not the peak. That's what's scary, Craig. This is not the peak. This is the incline, because when you look at our test positivity rate, it's doubled in the last month. We know that we're doubling the number of cases. That means there are tons of chains of transmission that we're missing. That means people who are sick out there who are continuing to transmit this disease. And that's even before we're seeing the effect of Thanksgiving and Thanksgiving gatherings and travel. And that's why it's scary, because at the current numbers, the hospitals and our healthcare systems, particularly in rural areas, are heavily hit. And almost every state is seeing increases in hospitalizations and deaths.
You make a point that I think is salient, this idea that some have suggested, primarily on the internet, that the reason numbers are going up is because we're testing more. And the reality is that's not the case. Hospitalizations are up as well. Let's talk for a moment about these major changes that the CDC has decided to make to COVID guidelines. Now, apparently, you only have to quarantine for 7 to 10 days after being exposed to someone with the virus. We've heard for months now that COVID-19 takes up to 2 weeks to incubate. So why the change?
Yeah, Craig. So I should start by saying that the CDC hasn't updated it yet. We hear these from sources, but what they're proposing is that for people who quarantine is generally, it applies to people who have been exposed to someone who has COVID. So you don't have the disease, but you may be incubating it. And so what they're looking at now is reflecting the fact that majority of the people actually end up developing the infection between 4 to 5 days. And so by decreasing the days, what they're hoping is you either quarantine and you get tested by day 7 and you're out of quarantine, or you don't get tested and you're at 10 days. Their hope is that by really more realistically reflecting when a person may be infectious, that reducing that range, you can let people go back to work. And that plays a big role in trying to get, essential workers back to work, particularly healthcare workers and others, and to keep industry going. I think it's a welcome change. It reflects changing science, but I kind of want to see it updated on their website so I can reflect more accurately on it.
The UK, we've been talking about it this morning, the United Kingdom becoming the first country to approve Pfizer's COVID vaccine. They're going to start getting people vaccinated next week. Are you at all that the UK has beaten the United States to the ball here?
Well, I think this is one of those rare moments where we got to just celebrate that we have these vaccines and not fall into this vaccine nationalism, right? One thing I will say is no, I'm not worried about that, because Operation Warp Speed and the U.S. government has actually purchased a set number of doses. And so UK has done the same, EU has done the same. And so we have our allotted doses. And what we're expecting is that by the end of December, both with the doses that we have from Pfizer and from Moderna, about 20 million Americans and from what we know will be vaccinated. And what we know from CDC's Advisory Committee for Immunization Practices yesterday is that those Americans will most likely be frontline healthcare workers and those living in congregated settings, such as nursing homes and long-term facilities.
Vaccine nationalism. Dr. Naheed Bhadelia has added yet another phrase to our pandemic lexicon. Dr. Bhadelia, thanks as always. Do appreciate you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.